shouldn't be as hard as it is.
A Cedar Rapids family uses Medicaid waivers to help care for their daughter who has severe disabilities. But they say it's clear the system needs to change. The Iowa Department of Health and Human Services is redesigning what's called the Home and Community-Based Services Waiver Program, which provides things like adult daycare and case management for those with disabilities who generations ago would have been institutionalized. KCRG TV9's Molly Swain joins us live in the studio with a family who is paying close attention to any waiver changes. Molly?
That's right, Beth. I met Natalie Klaus and her daughter Gwendolyn in the hospital where Gwen was getting discharged after her 13th admission this year. We talked about how life-changing these Medicaid waiver services have been for this family, as well as the major problems that still need to be addressed. Natalie Klaus says one of the things that always makes her daughter Gwendolyn laugh is a blast of cold air from those big coolers at Sam's Club.
She is the happiest little girl you would ever see in a million years.
This happy little girl also lives with Zellweger spectrum disorder.
She's one of 2 kiddos in the state of Iowa who have the disorder. It impacts all of her body systems, so she's blind, she's deaf when she doesn't have her cochlear implants in, she's developmentally delayed and nonverbal. She also has stage 4 liver disease.
Klaus told me she had never even heard of the Medicaid waiver program until a friend told her about it when her daughter was born.
At first I was like, we don't need services. She's a baby and we have insurance. What's the point? And she said, well, there's a really long wait list and you might need services someday.
And the wait was long. She applied for 2 waivers back in February of 2019. And she was on the wait list for one of them until May 2023 and the other one until about 3 weeks ago.
When we filled it out, I remember I was really upset because they said there's a really long wait list, and I was crying because I'm like, well, she's not supposed to live a year, so we're never going to get off the wait list.
Klaus is not alone. According to the director of Iowa Medicaid, Elizabeth Matney, there are currently 14,000 people in Iowa on the wait list for care. For the Klaus family, finally getting off the wait list has been life-changing.
We were able to use get medical daycare for Gwendolyn because she can't go to a normal daycare.
Good job, Gwendolyn.
Klaus also said waivers have covered medical supplies they used to pay for out of pocket. Officials have acknowledged the long waits and other problems and are sharing plans to redesign the waiver program by reducing the number of hoops people have to jump through and shrinking the number of waiver categories. Klaus worries the redesign still won't get at the #1 problem.
I just don't know how many kids out there never get the chance to have any services because they die while they're waiting on a wait list.
Gwen is getting services, but even so, life is still challenging for this family.
And the frustrating thing is sometimes you just want to be a mom and you don't want to be an advocate, a nurse, and all those other things. You just want to be a mom.
But Klaus said she's happy she can enjoy the time she does have with her daughter.
We know it's just a gift. It's just a blessing. We know every day is a blessing. And so in that regard, we're pretty lucky.
There are 3 more listening sessions for those who want to learn more about the redesign or give feedback on these programs. They're all virtual meetings. You'll find more details about them on our website with this story. In the studio, Molly Swain, KCRG TV9.